The KJLH 20th Annual Women's Health Expo at KJLHradio.com. Presented virtually by RastAfri and Radio Free. KJLH.
Well, hello there, and thank you for clicking on to KJLHradio.com. Welcome to the KJLH 20th Annual Women's Health Expo. Our health, our wealth, our power. Brought to you virtually by our friends at RastAfri. What we have in store for you today is even more important than ever before, given, of course, today's climate. We have a great opening health panel for you and breakout sessions that will provide insight and information on issues that impact our daily lives. Hi, I'm Tammy Mack, host of The Tammy Mack Show, Monday through Friday from 3 to 7 p.m. on Radio Free 102.3 KJLH. Our opening panel is hosted by the Steve Harvey Morning Show's Ade Lamar and features cardiologist Dr. Janet Way, Dr. Bill Relaford, diabetes specialist, Dr. Cynthia Davis, our HIV, AIDS, and COVID expert, board-certified obstetrician gynecologist, Dr. Latanya Hines, Chief Deputy Director of the LA County Department of Mental Health, Dr. Curly Bonds, and of course, our COVID expert, Dr. Muntu Davis, County Health Officer for LA County Public Health Department. So, let's get started.
You know, we're always excited when this comes around. Usually we're in with the big crowds, but we're so excited that we were able to find a way to still do it. We're celebrating 20 years, and we really pride ourselves in being able to get the best doctors to talk with our ladies and talk about health. So today we're going to talk about our hearts, heart disease, still the leading cause of mortality, and more young women are having issues. Why is that, doctor? What are we doing wrong? What do we need to really get a hold of?
Yes, that's an excellent point. You know, it's so important to pay attention to our heart health. Just as you said, unfortunately, heart disease is still the leading one killer. Over 800,000 Americans die each year from heart disease, and half of that is women. And we're finding that women under the age of 55 have had a gradual increase in heart attacks over the years. We think that it may be related to the increase in prevalence of obesity, diabetes. We see a lot of hypertension. And so we know that these are major risk factors in the population, particularly the African-American population, have a higher prevalence of these cardiovascular risk factors, the obesity, diabetes, and hypertension. And that's why it's important to understand what your risk factors are. And the good news is that 80%, at least 80% of heart disease can be prevented. You know, we always hear about the family history, but we can't do anything about genetics, right? But what we can do is to pay attention to our numbers, know what your blood pressure is. A blood pressure greater than 130/80 may require medications. It used to be a cutoff of over 140/90, but that has been lowered over the past few years because we're now catching up to the science. We're now understanding that no, that is too high. The recommendations really are to start medications, especially if you have other risk factors for heart disease, if your blood pressure is over 130/80. And hypertension is a silent killer. You know, we don't really know when we have high blood pressure. We're just walking around without any symptoms, and that's why getting your blood pressure checked at least once a year with your doctor is very important.
You know, doctor, it's so ironic that you said that, because when we do the big forum and we have all the testing and everything, I can't tell you how many women have had their blood pressure checked and didn't know that it was high. They were walking around and needed to go see a physician right away. And we've had to send people to go, like, you have to go right now. When you talk about those numbers and we think about the obesity, all these other things, women are we take on so much of everybody else, for the family, for our coworkers, for our extended family. That plays a big part too, you think?
Yes, stress does play a major role in cardiovascular disease. We're learning more and more about how that impacts the way that we take care of ourselves. And most importantly, if we can't take care of ourselves, then we can't take care of our loved ones. So it's very important when we talk to our women patients, or even our family members, friends, that, you know what, yes, you have so much responsibility for taking care, paying attention to your old aging parents, your children, your significant others, often your entire village, right?
Yes.
But without you, you know, without your health, you won't be able to do much of that. So it's very important, despite all our busy responsibilities, the added stress of COVID, to still keep up with the general health maintenance, which involves, you know, knowing your blood sugar, make sure you're not at risk for diabetes. And if you do have diabetes, getting that under control using nutrition, exercise, and medications if needed. Making sure that you quit smoking. You know, this is a great time to commit to smoking cessation. It's the hardest thing, people often say, but if you're dedicated, then there are ways that your healthcare providers can help you through that journey. Making sure, as I mentioned, the blood pressure numbers are under control, checking your cholesterol. High cholesterol is also a leading contributor for heart disease. And then trying to incorporate the exercise, and, you know, as you know, sometimes we think that exercise is such a daunting word, right? Oh my goodness, I need to go to the gym, but right now we can't go to the gym.
Right.
So incorporating your daily steps, you know, getting a step monitor, or even just spending a dedicated 30 minutes a day to walk around, to jog if you enjoy it, bicycle ride, or even just dancing in your living room.
Hey, we could all get that in right now, right?
Yes.
And you're saying that, I believe I've heard you say before, 10,000 steps a day.
That's right. That's the goal. That's the goal of 10,000 steps. Of course, even if you get above, you know, 5,000 steps, we want to make little small changes over time. So if you got one of these monitors and thought, oh my goodness, I spent a whole day sitting in my office or sitting in front of the computer, I only got 2,000 steps a day. Well, the next week, make it a plan to go to 3,000 and then 4,000. So make it a gradual, stepwise goal. That way it doesn't feel like you have to suddenly increase to 10,000 all at once.
Once I put the Fitbit on and saw that I was barely moving, it really did challenge me. I made a game of it to get up and like, okay, I'm going to do this. I'm going to walk this. And my friends and I would compete. So, you know, you guys are out there, family, get with your girls and your girlfriends and just compete about it. We compete so crazy trying to get these steps in. So what kind of heart conditions do we need to know about?
Yeah, so the main conditions to be aware of are the heart attacks, the strokes, heart failure, and then an abnormal heart rhythm called atrial fibrillation, which can increase the risk for heart failure and strokes. And let me spend just a few minutes to talk about some of the symptoms that you should be aware of that then would help your doctor make sure that you're not at risk for some of these conditions. First of all, with heart attacks, we use the word angina or angina. Sometimes we say that differently. That refers to any sort of discomfort that we feel when our heart isn't getting enough blood. And the traditional symptom is chest pain. But sometimes in the media, you know, in movies, we see usually a man clutching his chest and saying, oh, I've got an elephant sitting on my chest. And while that is the most common symptom as well in women can actually have some different symptoms that might be signaling a risk for a heart attack. For example, women may feel more chest heartburn sensation. It may not necessarily be that pressure or squeezing sensation. They may feel nausea, vomiting, shortness of breath, feeling extraordinarily out of breath, or just feeling extreme fatigue, you know, suddenly feeling like a wave of fatigue. And of course, these are often accompanying the symptoms of chest discomfort, but we have to keep in mind that these are often atypical symptoms that a doctor may not recognize. And it's important for you, the patient, if you're feeling these symptoms, to really tell the doctor that, you know, this is not normal for me, doc. You know, I really need to get this checked out.
So it's important that we talk to our doctor about what we're feeling and we know what our norm is and what it's not, and to really advocate for ourselves once we get in there.
Yes, and that's why it's so important to exercise regularly, because exercise is a good, stress test for our body to say, my heart is used to doing this. And if you start noticing that, I was able to walk up a flight of stairs, months ago, but now I'm feeling that chest pressure or shortness of breath when I walk up that flight of stairs or walk, 5 blocks, that's abnormal for me. Then that's when your doctor may order a stress test for you.
And the stroke, I've heard so many things about that, seeing the disfiguration of the face. What other things do we
That's
look?
right. So a weakness on one side of your body, whether it's the arms or legs or the face, often a good test is to smile and see if the cheeks raise up equally. Sometimes we have people stick out their tongues and, move from the left to right. But any sort of new onset numbness on one side of the body, weakness on one side of the body, difficulty talking, that would be another potential symptom for a stroke.
Dr. Wade, when you talk about some of the things preventive care, you said control that cholesterol. What are the foods that we're eating that's causing the problems?
Yes. Well, we like to recommend a plant-based Mediterranean nutrition because a plant-based Mediterranean nutrition really allows us to get all the fruits and vegetables and whole grains that lower cholesterol, lower blood sugar, and also have the good antioxidants and anti-inflammatory mechanisms to keep our body healthy. The main things that increase cholesterol are things that are fried, things that are often tasty.
The good stuff. No, the tasty stuff rather. Not good for you, but tasty.
Having a diet in a high amount of trans fats. Red meat, unfortunately, does increase cholesterol. And then I think, though, importantly, it's to just get a lot more vegetables and fruits in our diet, making sure that your plate, if you're preparing your plate, is at least half filled with vegetables, and then just a quarter of the plate can be your protein, and then the other quarter should be more of the unrefined grains like brown rice, brown pasta, brown, wheat bread. And those kind of strategies to gradually increase more vegetables, minimize the fried foods, minimize the donuts, the cookies, can help lower your cholesterol, but also lower your risk for diabetes.
Diabetes, something that, our people call it back in the day, the sugar. You got the sugar. So many folks are coming up with that. It's not just her. Some people think, it's hereditary. It's something. How do you get diabetes? What exactly is diabetes when folks say, it's here, it's there, it comes and it goes? What is it exactly?
Well, diabetes in summary, without being really technical, is the disease of overconsumption and inactivity. And people that are not as active as they could be, and they're over-consuming low nutrient, high caloric foods in our community. As you know, I wrote a book several years ago called 5 Colors a Day to Better Health, because all of my healthy patients ate 5 colors every day. And even we talk about eating servings, I found out that no one knows what a serving is. You can go to a seminar and you can get a certificate, and you go to the restaurant and you don't know how to apply what you just learned at the seminar. So I said, let's write a book about just eating by colors. Forget about the portion size. You can eat as much broccoli as you want to, as long as you can eat 5 colors every day. Those are the healthiest people in my practice. So diabetes, disease of overconsumption, inactivity, they classify it into type 1 or type 2 or juvenile onset or adult onset. Most of the people that are in our community have type 2 diabetes, which means your body has a problem with metabolizing the sugar that you consume during a diet. And so that sugar will accumulate in your blood, and the liver sometimes, or the pancreas, doesn't know how to deal with all that sugar, and the receptors in your body don't know how to store that anymore, and insulin doesn't work, the pancreas doesn't work. So as a result, these elevated blood sugar has a toxic effect on every organ of your body. No organ is left unmolested from diabetes. And now let's weave that into COVID-19.
Mm-hmm.
We have people that are gaining more weight right now. We have people that are eating more fast foods right now. So the riskiest population or senior citizens living alone at home. So now you have someone who has a wound on their foot. They can't feel it, they can't see it, and they may not be even to smell it. And so now you have less traffic coming in and out of the house. And some of these, what were once minor foot conditions, are now escalating into things that are gangrenous and very life-threatening. Our people should know that on your foot, the most common route of infection is the fourth inner space, the inner space between the pinky toe and the fourth toe, because that particular anatomic position is where most moisture stays. That's the most common route where you would get a fungal infection. And once that fungal infection is there, it breaks down the skin, and that becomes the easiest route of infection into the foot. And the right kind of infection can go right up the leg, up the tendons, you end up in the emergency room. And then, of course, African Americans have the highest amputation rate in the country. So one of the things I think that when we talk about why are African Americans at higher risk, typically African Americans have a higher hemoglobin A1C number, which is the number that measures how well you've managed your diabetes over the past 90 days. Well, when you have an elevated hemoglobin A1C, a lot of your inflammatory markers are elevated. That puts you at risk of having the most devastating complications from COVID-19. One of the things that some new studies have come out to show that in the Black community and in this country, we have the highest level of fructose in our diet. And fructose blocks the effectiveness of vitamin D. And vitamin D is one of the supplements that is used to help prevent the most devastating complications of COVID-19. Sugar will make you gain weight so fast. I've had patients when we want our patients to lose weight, you can't make them just change their entire life. So let's move a few things off the menu. Let's just take away soda. Just removing soda alone, even if you're still eating potato chips, we'll get to potato chips later, right? But if you take the soda off,
and the juice,
we have a battle on our hands, but I'm confident that we, with programs like this, what KJLH is doing, and everyone on this call and this panel is doing, that we will make a difference. We have become a very, very inactive society that's even glorified. Even obesity, even in our women, has been glorified in some of the TV shows that you look at, where you can feel more comfortable with being obese and inactive. And of course, look at the number of hours our people spend watching television.
What are the things we need to know? What should our weight limit be in proportion to, I guess, our height, and as African American women? What is it, the AC1 be, to know that we are, how close we are to being pre-diabetic or diabetic?
We can go through that exercise, right? And all that information is easy to find online. Or you just Google normal weight for this height, that weight. That's the easy part. The hardest part is to change your mind. Once I can change my patient's mind, everything else, then that information becomes more useful, because you've embraced the attitude that I want to be healthy. And the other thing I've found is that patients who have purpose tend to do better. I wouldn't want to start about, what should your ideal weight be? Mentally, mindfully, you need to feel good about yourself first. And you need to have the image.
That some women are going to say, I feel good at this level. I feel good right here.
They're not telling you the truth. They're not telling you the truth, because when they go home, they sit and they look in the mirror, they watch television, they look at magazines. The body should be under subjection or to submission to the mind. You're just talking only about the body. I need to get into your head first to make sure you have the right mindset. No one talks about why I need to be healthy. They just say, you need to lose some weight. But why? You know why? So you can be productive and grow your business. You need to be healthy. Why? So you can leave a legacy for your babies.
So let me try to give a complementary perspective. One of the things is that as a patient, the doctor is there to give you advice and answer questions. And when you get information from that doctor, you should ask, is that good? Is that bad? And if they say it's bad, say, okay, well, what will it do if it stays this way? And what do I need to improve it? They are to advise you, but if you don't ask questions to understand what they're telling you, it becomes harder for that to be a good doctor-patient relationship or to get to the whys.
I found that, and I've encouraged my patients to bring a notebook or a notepad to the doctor's office with you. It sends the message that I care about myself or my mom or dad. Ask questions like, what's your name? Or what medication is that? Keep a little record. Did you know that last week you wrote a prescription for that? Or a doctor down the street wrote a prescription for medication. Is this going to have any kind of interaction?
When the patient invests in themselves and they come to the visit ready to ask questions and ready, if necessary, to challenge what the physician is saying, that is going to have a much more meaningful interaction. And speaking from a Kaiser standpoint, we get at most 15, 20 minutes per patient. Probably half of that time is spent with the nurse. There is a seminar that we as physicians have to go through, and it's called Investing in the Beginning, making sure that the patient understands that you care about them. You ask questions about why they're there and really listen. You also shut up in the first 5 minutes of the visit to sit and listen. The patient will tell you what's wrong with them if you just listen. And sometimes why they showed up, what the chief complaint is that your nurse wrote down, is not at all why they're there.
Absolutely.
They want to be heard. And when they feel that you are listening, then you can do your work. And so I think that's very important. And that's where let's be elephant in the room. Racism is the governing factor with regard to some of the most significant health disparities in this country. We can talk about the incidence of diabetes and hypertension and obesity and poor food choices and racial covenants and why we can't live where we can live and the food and the accessibility. But all of that is racism. And once you as a physician, whether you're white, black, or other, understand that, when you see somebody that's coming from some of those communities, you now understand it's going to be a little bit different in investing in that relationship, because treating everyone the same is not equitable.
It's not.
Some people are going to need more. And so that's where, for me, I come in as an obstetrician, as a gynecologist, but also as a Black woman, as a Black female married to a Black man, as a mother, as a woman. So I can see all of that in that interaction. So I hear you very clearly, Dr. Relaford. But I think when you dial it back, as Aday was talking about, why do we want to lose weight? Remember that a 300-pound woman walking in the room is, to me, a manifestation of, clinical depression. Absolutely. She's talking to you when she walked in the room at 300 pounds. If she says that her idol is Lizzo, and you go, okay, but are you doing what Lizzo is doing? Or are you just standing back saying, I'm glad she's a big woman and she's professing her comfortableness in being big? Lizzo is running and jumping and playing the flute and doing all kinds of stuff. What are you doing?
Look, I want to encourage what was said about, writing down your questions and bringing a notebook. Because, we all forget and we have a really important question that we wanted to ask and we just forgot. But if you write it down and bring it in, that's also just a practically helpful situation. Yeah. The other thing I would say is, sometimes, I've given advice to people and later asked questions and found out they couldn't follow that advice. So if I say eat fresh fruits and vegetables and all you have are, convenience stores and they don't sell that, or the stuff that they do sell is super expensive and not good quality, meaning it's rotting, then you can't follow that advice. So really asking those questions and figuring out what you can do. And if you can't do what they've said, figuring out, well, what may be an alternative? Who else can help me with that? But you have to bring those things up because sometimes it won't come out automatically.
Okay, so everybody's been chiming in about COVID, okay? Things are being closed down just when we thought we were getting some things to reopen. We knew that this second wave was going to come back around, or we heard about it happening. Are we actually in the second wave?
I wouldn't necessarily call this a second wave, given that we had some pretty good control as a county with everybody being at home and the rates starting to come down. And then as things have started to reopen, we're starting to see more cases. But I think that is just because people are out and about more, and not everybody is adhering to the recommendations of wearing face coverings and staying away from others who are not their household members.
When we hear stories, I remember when I first started reporting that African Americans were more susceptible because of underlying conditions. And I got so much pushback on my social media. Oh, once again, it's an African American disease. It's this. They're always trying to push it on the black man and the black woman. Oh, give us the real rundown with that. Why is it so important that we understand that we are susceptible to this?
Well, I'd say that in many instances, a lot of communities of color, especially those that are of higher concentration of poverty, have been more susceptible. And I think historically, not having access to resources, I believe Dr. Bonds mentioned, not having the testing available right away to be really diagnosed quickly and figure out what you need to do before others got impacted. I would also say that we know that the high risk for serious illness are in those with chronic underlying health conditions, whether it's heart disease, chronic lung disease, whether you have cancer or some disease that impacts and weakens your immune system. Those factors come into play. And so we know that those rates are higher in our community. It doesn't mean that we're the cause of that. It just means that over time, we have been exposed to more things that have made those diseases more prevalent in our communities than in others. And so I would say that the other thing that I think came into play is if we're talking about lower income jobs, those have typically been what we call your essential workers.
Yeah, they are.
The grocery store clerks, those who might be at the bank, those who might be, at the gas station, you name it, other places where people are really do need to have some contact, with others because they need their basic needs met. And if we're predominantly in those jobs, then we're more likely going to be more exposed, and therefore we're at a higher risk of being exposed than others who are able to sit at home and not work, out and about.
Exactly.
African American women, do we have an increased risk as African American women, since we're talking about our health? Do we have an increased risk?
We haven't seen a differentiation, not significant, between men and women in general. That's one interesting thing about COVID-19. It's impacting, the genders about equally. I can say that in general, for our communities of color, typically we had seen African Americans have a higher mortality rate. And we are starting to see at this point, if we take the white population in terms of their mortality rate, it's about 19 per 100,000 people. And for Hispanics, Latino, Latinx, Black, African American, we're roughly around 37, 38 per 100,000 people, which is double. If you take lower income communities, it's about triple at about 64 per 100,000. So those are some of the stark differences that we're seeing. And even for our Asian community, they're at 25 per 100,000 people. So we're seeing differences amongst the population, and definitely in communities that are under-resourced, we're seeing higher rates of death.
We were talking about COVID-19 and how this affects everybody now being more active. They're more quarantined. Everybody's a little friskier, and things of that nature. But we were saying, everybody's up close and personal, and COVID is still out there lurking, trying to get in, right?
Right. A couple of things about COVID. I happened to be at a press conference with Mayor Garcetti back in April. They asked me to come and talk about the importance of testing for COVID. And I did a brief little spiel on how COVID is similar to HIV in terms of how the question was, is COVID similar to HIV in terms of how it's spread? Mm-hmm. So one thing that people need to know is that COVID and HIV are both retroviruses. And one of the characteristics of retroviruses is that they're constantly mutating, okay? Changing their structure. But COVID is very different from HIV. So COVID is spread through respiratory droplets, which can become airborne and or can be picked up on surfaces. COVID is also found in saliva. So you can be exposed to COVID through saliva or through kissing. And then COVID is also contracted from casual contact with an infected person. That's what they're talking about, community spread, where people are out having birthday parties, pool parties, going to bars, hanging out.
We have to shut them down.
So COVID is very, very contagious, okay? And there's been no research indicating that it's spread by sexual contact, thank the Lord, okay? Even though it's been found in semen, but not in vaginal secretions. Now with HIV is not airborne. It's not spread through respiratory droplets, nor can you acquire HIV by casual contact. I talked about that a lot. You're not gonna get it from casually kissing somebody on the cheek, shaking their hand, hugging them, being in a pool with them. HIV is transmitted sexually, but not normally by kissing. Also, air kills both COVID and HIV. So again, when I found out that when you take the oral COVID test, I was told that very, very high concentrations of COVID are found in the tissues in the cheek. So that's when a light bulb went on and I said, if that's the case, it's in saliva and you can get it with kissing. So in terms of intimate contact with someone, whether or not you're straight or gay, you're gonna have to be concerned because number one, when you're up close to someone and you don't have a mask on and say you're infected but you're asymptomatic, you have no symptoms, you could be spreading it during sexual intimacy because you don't have a mask on.
I can't imagine where we would be without you getting that education out there because you save lives, you prolong lives. And I love when you come in because you're always sharing the latest and the greatest in information. You always still though let us know that there's still work to be done. That we still got to keep trying to educate and re-educate. And so when you come in, I always like to start with, where are we right now? I kind of remember where you tell us we are from year to year. So in contrast, where are we with getting the words out and knowing where we are with this?
Well, when it comes to HIV, we're not any worse, but we're not any better either. So for African-American people, both men and women, we're still disproportionately impacted, even though the numbers have gone down. When you compare African-American rates to Hispanic rates to rates among white people, our rates are still higher. And so right now it's estimated about 1.1 million people are infected with HIV in the country. And of this, there's been over 700,000 deaths since they started reporting back in the 80s. And annually, there are about 38,500 people still getting infected every year in this country. And of those, 44% of them are among Black people.
Wow.
So we still have our work cut out for us. People think that, well, there's effective medications, it's no longer a death sentence, that they can be a little lax, but that's far from the truth. So we still have to practice safer sex. We still have to use universal precautions. We still, if we're sexually active, need to be taking an HIV test every year because there's no cure for HIV.
Right.
We have not been able to find a vaccine in 40 years, and it's not going away, and you're vulnerable.
Yeah.
If you're out there having unprotected sex, having multiple partners, mixing drugs and alcohol when you're having sex, shooting drugs. So, having unprotected casual sex,
Right.
you're going to be at risk. And then you got to think about the new generation who wasn't around 40 years ago and doesn't know the full impact that it can have.
Right.
Because with effective treatment and medications, people are living normal lives. You can't tell by looking at somebody that they're HIV infected.
Absolutely.
Because with HIV, once you're infected for life, When people come to my mobile van and test, even though they know they haven't been sexually active, they just want to have a test to have peace of mind. A lot of older women over 40 are practicing abstinence.
Abstinence. And that protects them. So we talk so much about HIV, but that's STDs period out there.
Right. That's correct.
Yeah.
That's correct.
Some people are having the luxury of being able to work from home. I'm able to work from home. Others are, but those that have to go to work, you've got to be in the office place. You don't have that luxury of being able to stay at home. How can we protect ourselves?
One of the things that we took a stance on was really that we needed to do and put out the guidance that was needed, not only for the general public, but for workers to know what they should be doing in workplaces. In those requirements, and there are protocols. So if you're going to reopen as a business, no matter what you are, you have to look at that protocol. If you can't implement all of those things, you shouldn't reopen. And in part of that protocol, one of the things that you're supposed to do is give your employees that protocol to show what you are doing as the business owner and to protect them and what is expected of those clients that are going to come in as well. And so those protocols are readily available on our website. So if you work in a sector and you're trying to figure out, what you should be doing, what you should expect, it's there on the website for you. But to make it simple, if you're going to be interacting with the public in any way, you're going to be wearing a face covering, and that's for anybody. And the business should provide you with one. Now, you should also have some backups, just in case, and that face covering should be washed every day. If you are sitting in your office and there's no one else around, you don't have to wear that face covering on. But if you're going to go out into the hallways or if you're going to be interacting with customers for however brief of a time it is, then that face covering needs to be on, and the customer should have one on as well. You also need to be able to have access to hand sanitizer if a bathroom is not readily available, and you should have time to be able to do that, and your bosses should give you that time to go clean your hands. The other thing is, try to, as much as possible, not be in close contact with people who are not members of your household. Now, in each space, it's a little bit different in terms of how that works, but those three principles should be at play in terms of spaces. I will differentiate. Some sectors are different. If we're talking about a restaurant, that customers can't wear a face covering when they're eating or drinking. So we require that those who are serving also wear a face shield in order to protect, anything from flying out of the customer's mouth from hitting your face or your eye, which could potentially infect you. So you wear a face shield and a face cover. Face cover is to protect others. The face shield is to protect you. And so each sector is a little bit different just based on the risk that we assess for that sector. But we have put those things out in protocols. You can look it up as an employee, you can ask your employer for it, and you should be able to get it both ways.
Now, when we're talking about businesses, a lot of people are in closed quarters in their businesses, and they're going to have to make that social distancing space between the cubicles and stuff. But what else with ventilation and air conditioning? You hear so much about the air conditioning and the ventilation that has to be in place. What are the protocols for that?
Well, as much as possible, and depends on the age of the building, we want you to try to increase the outside air that's coming in. But in reality, if you have people who can work at home, let them work at home.
I saw that there was a number, I don't have it readily available, but perhaps you have know-how, that we as residents and citizens can report when we go into businesses and we see them not following proper protocol.
Typically, it is through our environmental health department, which is on our website, and you don't have to call. You can actually, send in a message on the web as well. So that's readily available. Things have started to open up. People have gotten a sense that things are safe, and the virus is still circulating. So, it's not safe. We talked about safer, in the workplace in terms of what things need to be done, but the virus is still circulating and is really infectious. I'll give you the phone number. So the customer call-in center is 888-700-9995. Again, that's 888-700-9995, and that's Monday through Friday, 8 to 5. It's also available on our website to report a violation by email or online. And our website is publichealth.lacounty.gov.
Do you think we're close to a vaccine?
I think it won't be until maybe next influenza season, that we do get one, but we'll see.
I had a question for you, Dr. Bonds. Have you guys been following the trends since the shelter in place or COVID? And are the suicide rates nationally and or in LA County, are they steady or are they increasing?
Well, I wish I had a direct answer for you, but suicide is a relatively rare event. I would say that what we've seen are some pretty high profile suicide attempts, but in terms of actual people who die by suicide, that's not something that we'll know the numbers probably now. It'll be 6 months to a year out. Okay. Our department does the treatment. I would say that the Department of Public Health is maybe more up to date in terms of the numbers, but usually those numbers do lag behind the events, and they also have to be accurate in terms of determining the cause of death. The coroner's office makes those reports, and sometimes it takes a while for us to find out. But what we have seen, though, are more people who are in distress. They're under domestic duress. There's more evidence that child abuse is not being reported. So we're trying to make sure that all of those resources are out there for people. We also know that from the civil unrest, a lot of communities of color were just feeling like, why is everybody just now noticing this? So even though it's to some degree a relief that people are putting a sharp light on racism and racial inequalities, it's been there all along, but now it's on videotape, it's on the internet, it's something that everybody has seen because we're all sheltering at home. So it's this perfect storm of moments in time that people were paying attention. And now that they're paying attention, there's a big question about what are we gonna do? So for a lot of my colleagues who are African-American or minorities, they feel like, well, the pressure comes on me. I mean, in terms of educating everyone else, but really this is everybody's problem as a society to figure out how are we going to cope with it? What are we going to do about it? We've come to terms with it, but we haven't really changed anything yet. So the big question remains is what are we going to change? And none of us is well until all of us is well is something that we say at the Department of Mental Health. And so we really need to make sure that we're addressing this for all communities.
When we talk about the difference between men and women, how we deal with certain things. As a woman, when I saw what happened, what they had reported, what happened to George Floyd, it affected you not just in the moment, but you carried it. I mean, you really felt the heaviness of it. How can we calm ourselves in those moments?
I wish I knew the answer to that. But I'll tell you what my thoughts are. There are internal things that we can do to keep ourselves healthy and to improve our well-being. And there are things that we do to improve the world around us. And you have to be cautious that you first take care of yourself. So I'm going to talk about that first, because if you're not there and you're not healthy and engaged, then you're not going to be any help to anybody else. So I think that for many communities, faith is an important thing. And I want to emphasize that going to church, staying connected, if you have a higher power or a spiritual belief, whatever your practice is of spirituality, it's important to stay engaged with that. It's been difficult though, because a lot of churches have had to shut down or close their doors, but many of them have gone virtual. If you don't have a spiritual base, then a connected community, communicating with people, even talking about what's happened. What has been your experience? I've had people while I'm out walking my dog ask me how I'm doing. And these are people who never noticed me before. So I think that there is an opportunity for us as a society to begin having some real conversations and not just avoiding the elephant in the room that's been there for a long time. You mentioned Mr. Floyd in his dying moments, it's important that he called out mother. He called out for his deceased mother. That just tells you, I mean, we're a very, I think, especially for African Americans, a matriarchal society. You know, women are the ones who have gotten us to where we are. And I think a lot of people grew up in homes where mom was the most important character and most central feature to people's lives. I think to reach out, you know, check on the folks that help get you to where you are. Stay connected to your community, stay connected to your family, call them up. And if you're blessed to have a mother, then, you know, let her know that you care about her. And I think another thing is what you do externally. External things are when you reach out and decide, what change am I going to make? Be it donating to a charity, be it deciding that I'm going to march if it's safe for you and you can do it with physical distancing and wearing a mask. Maybe you can get involved in the social activism that's going on. I would say social media is another place where a lot of people, even though you have to be careful that you don't end up just getting in these dark corners of spending too much time online and getting wrong information, there's a lot of good, healthy resources. For the Department of Mental Health, our website, which is lacountydmh.gov, you can go there, you can find resources for COVID, you can find resources for talking and engaging around the civil unrest. And one thing that, getting back to the self, is to meditate. A practice that I've adopted, which is one that we've encouraged all residents in LA County to do, is to use an application called Headspace. If you go to headspace.com/LA County, then you can find out that you can download this application for free until the end of the year. I'll put my plug in, you know, I Fitbit, I Headspace. Just taking 2 minutes a day helps to bring down blood pressure, helps you to focus on the here and now. I think those types of interventions are truly important. And if you are having a crisis, if you really are having more than just the ordinary symptoms, you can then go to the website for the Department of Mental Health, or you can call our helpline. We have many different access lines that help people that are having an actual crisis, like if you're suicidal and may need to go to a hospital. But if you just need someone to talk to right now, there's a warm line. So the number is 1-800-854-7771. I know that like the back of my hand right now because I've been giving it out so much. So hopefully we can get it to our listeners.
I just wanted to bring up that with the sheltering in place and people were talking about being with their families, and there's that positive aspect that people are spending more time with people that they didn't necessarily really know as well. And now they've gotten to get to know them. And that has perhaps deepened their bonds and made a better family support system. But there's also the opposite direction. And that is that when you're sheltering in place in a not so safe situation, and we see that as gynecologists and clearly as obstetricians, that they're now sheltering and pregnant in a domestic violence situation that worsens. And so I want to bring up that, you know, people are so afraid to come to the doctor because of the potential for exposure. And yet we are considered to be the primary touch points where we can at least make the, you know, contact social services, contact some of the resources for these people who are in situations that are not so positive. So I want to at least bring that out because I know that it is relevant, it is very real, and unfortunately very common.
Thank you for mentioning that. I've heard many times that natural disasters, be it a hurricane or earthquake or even a pandemic, are relationship accelerators. And what they tend to do, if a relationship was going well, people are like, well, you know, we've been cozying down here, maybe we ought to just tie the knot. So it can move it in a good direction really quicker. It can also move it in a bad direction. Those people who are in difficult circumstances, it can make it go bad very rapidly. I was going to mention, I don't have the exact interface, but there's a text option to get help from us as well. And that should be on the website because not all the time can you call up or make a phone call. You might have somebody who's, you know, listening in. So for kids and for people that are tech savvy, there's the option to text for help too.
Excellent.
A great time to give a shout out to Genesee.
Yes.
To Karen Earl and her team over there being very vocal about this from the beginning with the pandemic.
So what I wanted to remind people of during this time of COVID-19 is that domestic violence shelters are still open and they're still accepting people. So if you find you're in that situation or know somebody who is, those resources are still available. And for the county phone number for domestic violence hotline, that is 1-800-978-3600. And you can also call 211, you know, if you know somebody in that situation or you yourself find yourself in that situation.
Dr. Hines, you're up. What would you like to share with us what you do there at Kaiser?
So I am here with two hats. Actually, I have three. The Association of Black Women Physicians.
Yes.
The African American Infant Mortality Coalition. Mm-hmm. And of course, Kaiser Permanente. So, and all Black women, MOCA OBs. So I am always very proud to be a true representative as best I can from the community that I came from. I was born and raised on 45th and Western in Los Angeles, South Central. It is a reality that Black women have a 4 times higher risk in comparison to white women for death in pregnancy. Black children, those infants, have a 3 times a higher risk of death in the first year of life. So that's huge, right? So what is the problem? Well, I'm gonna hit it. It's racism. Let's just say that. We are not genetically inferior. If anything, I think that we are exceptional in the fact that we're still making babies. I think that we are amazing people. But when it comes to access to healthcare, making sure that our diabetes, Dr. Relaford, that our high blood pressure, that our weight is well controlled before we even start making another human being, therein lieth the problem. So I get you at 22 at 250. Your friends and family tell you you're pregnant. You can eat for 2. And by the time I get mid-pregnancy, you 300. Now the risk of gestational diabetes in pregnancy and insulin dependence or resistance, as well as elevated blood pressure, well, that's gone through the roof, right? So when we think about higher risk pregnancies, even in a 22-year-old, we start off higher. And what I push so much for is the acknowledgement that if you are a Black woman and you are pregnant, I know you don't like it, I'm gonna click high risk just because the level of surveillance and resources available to you are higher. Now, if you prove to me that despite those things that I found, that you keep your blood pressure well controlled, your weight is well controlled, that you're doing everything that you can, I'm expecting a good outcome, an excellent baby. I want a vaginal delivery and not a C-section unless I have to. And I want both of you to walk out of that hospital in great condition. You are supposed to survive pregnancy, but we don't. That is a problem. And so we as a group, from the mental health standpoint, from the internal medicine and all around health standpoint, are doing everything that we can, that from the beginning, when you come in with a positive pregnancy test, that you end that pregnancy, first of all, not preterm, and that you make it full term and you have an excellent outcome. We know those numbers are not as high as we would like them to be, but they are getting better. There are interventions, and that's what the AAIM does, is make sure that we have those resources. Doulas, people who can advocate on your behalf when you can't, that you don't want a C-section and why, and know how medicalization of obstetrics happens. How if you say, I'm tired of being pregnant and I'm 40 plus weeks, and you don't quite understand that, you know, that due date is kind of gray. But we know that the spontaneous process of labor is so much better as opposed to us inducing you. We know that by the time you show up at the hospital, if you keep complaining and screaming at us that somebody's going to put an IV in you, next thing you know, you're going to be on Pitocin and have a bad tracing, and now you get a section. Well, let's not have that happen. Let's inform our mothers on websites and resources in the community like Black Healthy Babies and First Five and the March of Dimes and all the other people that I'm representing today, about what we can do to make sure that your mental health and your physical health is optimized before you get pregnant. And then by the time that you are pregnant, that you've got the support. I've got to bring up our Black fathers out there and let them know that they are loved and needed and wanted. And we need them in this process. And that COVID has made it a lot more challenging. And yes, the isolation of being pregnant and coming to your visits by yourself is hard, but it's for the safety of both you, your baby, and your partners and family. And that there's so much that we are doing, certainly at Kaiser, but in the community as a whole, because, you know, I'm quite the community advocate, I'm everywhere, to let people know that we are with you and that the distrust of the healthcare system is, to some extent, can be warranted, but we cannot go back to less than 100 years ago where death in pregnancy was considered to be, it happens. We can't die of hemorrhage. And so a lot of my patients, but also in the community, will ask me about the 3 famous ones: Serena Williams, Beyonce, the Kardashians. And all of them, unfortunately, had complications in pregnancy that are relatively common that many Black women have, which is hypertension, complications associated with hemorrhage. Serena, of course, had a PE or pulmonary embolism and a history of DVT. But People see them as these hallmarks in the community and that there's nothing that could happen to them. They wake up Black every day. And the systems in which they were navigating, despite all the money that they still had to deal with being Black every day. So I am as strong as I can be, the strongest advocate for making sure that all patients, and especially my sisters, are seen individually. When they say, well, I don't see color. I have some colleagues that say, I don't see color. No, I want you to see color. I want you to see that the woman standing in front of you should get more attention and more surveillance. And if she proves that she's low risk, that's all right. But you see, your surveillance and heightened suspicion is higher. So when she says, I've got abdominal pain, you don't say, maybe that's the round ligament. It's not a big deal. You can get away with that with some of my white patients. But she might be telling you about the early beginnings of preterm labor and changes with her cervix. So you've got to do a little more work. You got to check her cervix more often. You've got to ask the questions of our previous preterm delivery, and she says, I don't want that medicine. You got to strongly advocate and say, look, I'm not trying to have my name on your negative outcome. We also have a COVID flu virtual meeting coming up in the fall. And what we're trying to do is to let our pregnant women all over Southern California know, especially those African-American pregnant women, what we can offer. And of course, as Dr. Relaford brought up, and then Dr. Mundy, all of them, right? How are we gonna get our folks to take a vaccine?
Hey, no, that's gonna be.
I can barely get, I don't even have my button on, I can barely get the flu vaccine, only because, and I have to subtly, tap dance around the fact that, no, I took my flu vaccine, I'm still with you, I'm not dead, and I don't have any other diseases, to try to at least mitigate the severity of the flu, because nothing is perfect. And the flu vaccine, they have to work on that at least sometimes a year ahead of time to try to find what's going to be effective. So with this new vaccine coming out, and this is important, we don't even have a treatment that's significant enough to mitigate the symptoms in those with mild symptoms of COVID. Remdesivir, if I'm saying it correctly, with its expense and the craziness with that, it's given to those patients who have severe symptoms. So we don't truly have effective treatment that mitigates the symptoms of COVID. We don't have a vaccine to reduce the likelihood of having it in the first place. So in my mind, until that happens, it's the same as it was 3 months ago. Don't let your guard down, wear your mask, wash your hands, be paranoid if you need to be, because that is where we are. I'm gonna work in my own little world a day, and I'm gonna do everything that I can to have the healthiest babies and the healthiest moms.
I think KJLH just really appreciates the opportunity to have you on when we do our KJLH Women's Health Expo, and that, so many that would love to be able to get to you but can't for whatever reasons. It's their opportunity and chance to really get to talk to you. And we thank all of you for joining us and being part of this, our 20th anniversary for the KJLH Women's Health Expo virtually. We got it started. There's so much more that you as our viewers can check out on our website, kjlhradio.com.
Okay. I hope you're ready now, because I am. Our expert panel and Auntie Maxine has got us all fired up for the virtual 20th anniversary of KJLH's Women's Health Expo. We now invite you to explore our breakout sessions and vendor floor. Just click on the sessions below and continue to enjoy and empower yourselves for better health, wealth, and power. And if you can't get to all the breakout sessions today, child, don't worry about it. We're virtual. We'll be here, and you can take advantage of all this wonderful information at any time for a long time, because our health is our wealth, and our wealth is our power. Thank you for joining the KJLH virtual 20th anniversary Women's Health Expo for yet another year, because we are you.